Hello everybody, welcome to my YouTube channel NurseEd Simplified. Today we will discuss about one of the most heated topics and requested topics, that is drug calculations and how it can be done in a simplified way. So let's start going. There are few terms and terminologies which you must understand before we look into the definitions or the simplification of our drugs calculations. So what are they? There are some terms like we will be told what is a flow rate. Like give it at this flow rate. What is a flow rate? It is the volume per unit time, which is usually expressed as ml per hour. It may be ml per minute and so on. Next is a drip rate. What is a drip rate? It is the number of drops that will go per unit. Usually it is drops per minute most of the time. Next is a dose. Dose, as we all know, it is the amount of drug that is given per unit to the patient. How is it expressed? In milligram per minute, gram per hour, or so on. Or it also can be international units per minute. Now, what is concentration? This is very important to understand. Concentration is the amount of drug that is given in a given volume. It is expressed as, you will hear it as milligram per ml, give it in gram per liters, or international units per ml, and so on. What is a drop factor? It is a number of drops per unit volume, drops per ml. You will hear that please titrate dopamine, or you can start titrating your what you call nitroglycerin. What do you mean by that? It is the adjustment of the IV medication dosage within the prescribed parameters, like titrate dopamine from 5 to 20. That is what you will generally hear. It is within that is a prescribed parameter to achieve a desired effect. What is the effect? I want the BP to be this much. Okay, so on. So these terms are not interchangeable at all, but you need to know it, because at first click you should be able to understand what they mean. Now, what I want everybody to know is that the measurement systems, they are basically classified into three: metric, apothecaries, and household systems. Metric is what we use generally, universally, and it is used in the units of 10. And basic units are your meters, liters, gram. Apothecaries, it is on the weight of the grain of wheat, that is grains, minims, drams, ounces, pounds, pints, quarts. It is very, very rarely used. Household is still something that we do use, that is your drops, tablespoons, teaspoon, cups, glasses. You will see it in pediatric measurements mostly. Now, we calculations, they are always or mostly they stick to these. Either it is formula based, proportion based, dimension analysis based. I don't want you to go into deep. What we are, because it is a simplified process, I want you to know the simple ones. And the simple ones are always formula based, because it's easy to remember the formulas when you use it on a daily basis. Before that, just to know that conversions. Now, when you do what you multiply it, what you divide it, and so on. For example, if you want microgram to be milligram, you have to divide it by 1000. If you want milligram to be into gram, again 1000, and so on. Gram into kg is 1000. So this is very clearly mentioned here. And what you generally get confused is between pound and kg. So if you want to make kg into pound, you have to multiply by 2.2. And if you want to make pounds, if you are given pounds and they want the answer in kgs, you have to divide it by 2.2. And similarly, if they might give you per minute, they might give you drops per hour, ml per hour. So in either case, you will multiply or divide by 60. Okay. Next, one thing that I would want each one of you to know is from centigrade to Fahrenheit and from Fahrenheit to centigrade. So if you want from Fahrenheit to centigrade, what is the formula? In bracket, Fahrenheit minus 32 into 5 by 9. So now I have just given a small example. For example, your temperature is 98.6 Fahrenheit and you have a thermometer which reads Celsius. How will you convert? This is a formula. It will 98.6 Fahrenheit would mean, after the calculation, 37 degrees C. And similarly, if you want to make Celsius into Fahrenheit, 1.8 C. How I got 1.8 C? 9 divided by 5. It will give you 1.8 C plus 32. So similar equation calculation has been shown to you. Now comes the main parts. That is calculation of the tablet dosages. What do you mean? Now, if you are given a dose and this is not the dose that has come to you, you have been told to give this much dose, but the medicine that has come to you is of another dose. So, how do you determine how to give, how much to give? So, the number of tablets will be desired dose divided by the stock strength. For example, I've given you 1500 mg of calcium carbonate, but the one that has come to you is a 250 mg tablet. So desired dose divided by stock strength, that will give you 6 tablets. So you'll be giving 6 tablets. Next is calculation mixtures and solution. Now what if the medicine comes to you in a solution? The strength is given to you, but you have to dilute it and you have to give the desired volume. For example, amount of solution to be given will be, the formula will be desired dose divided by the stock strength that has come to you into the stock volume that has come to you. Now, for example, as given in the picture, 750 micro mg of cefuroxime injection antibiotic, and you have a 10 ml diluting sterile water with you. So, and you are told to give 370. What has come to you is 375 mg. How will you give? So, it is desired dose is your 750 mg by stock strength, that is 375 mg, into volume is 10. So you will give 0.5 mg into 10, 5 ml. You will give half of it. Calculation of the IV rate, that is ml per hour and minutes. Now, whenever this will come to you when it comes to IV preparations. For example, you have 500 ml and you have been told to run it over 8 hours. How will you calculate? It's very simple. Total IV volume 500 divided by the time, it can be hours if you want to make it to minutes, into 60. So it will be 500 divided by 8, 62.5 ml per hour you will run. Till now, till the previous slide, it was a very simple one. Now we come to a little bit more difficult, but trust me, it's easy even there. Now they are telling you, give it to me in drops per minute. I don't want to know how much ml per hour. I want to know how you will give it in drops per minute. So when they say drops, remember in your mind, I need something called a drop factor. When they ask for drops per minute, I need a drop factor, right? So the calculation will remain the same. Total IV volume by the time, this time you will, because you have to convert it into minutes. So you will convert it into minutes, into drop factor will be given to you as 20, depending upon the set that you're using. If you're using a normal set, it will be 20. If you're using a pediatric or micro drip, micro drip will be 20, micro will be 60, and blood transfusion will be different. Okay, so each one depends upon how well, what is the drop factor that is coming to you. That is what is the set that you're using. That will decide basically what drop factor you will use. Am I clear about that? Okay. So next we want to talk. So how is the formula going? So as I told you, for blood giving set it will be 15. For normal sets it will be 20, and for micro it will be 60. So this is a normal set. So you already have the drop factor 20 given to you. So total volume is 500 divided by 8 into 60. I have converted into minutes because they want it in minutes. So into 20. So 20.8 drops per minute. We never give 20.8. We always round it to the nearest decimal point, whole number. So it is 21. Next is calculation of IV rate. This is, I will discuss with you in details in another video because this is a bit different. But what if generally you will get orders for some medications like dopamine. The doctor will tell you start at 5 microgram per minute. This will be the dose. Now, how do you do it? The dose will be little different. The formula will be little different. It is desired dose whatever they want, that is 5 microgram per minute, into the body weight of the patient, into 60, divided by the drug concentration. That should be in microgram. So if the desired dose, he told you 10 max, start at 10 max. You will start at 10 into body weight 60 into 60 your time divided by 2000. Now, how did I get this 2000? It's another video. I will show you how to calculate the dopamine. And the answer will be 18 ml per hour. This I will convert the available dose that I get into microgram. That is the conversion. I have another video following soon, which I will show you dopamine. I cannot show you in the same video. It is time consuming. So I will show you another short video for this. Okay. Stay tuned. 18. So the answer will be 18 ml per hour. So whenever they will ask you something where they will give you a microgram per minute, always dopamine, I put the name. Why? Because generally they ask dopamine like this. Dopamine drip, we start like this in ICUs and ER settings. So it is always, this formula is a bit different from what we saw in the previous. Okay. Next. Now we come to calculation of IV rate. That is, for example, the remaining time of the infusion. Now, when you come, you see that the remaining is 200 ml. So how will you decide your, how much over how much hours to give or how many minutes to give? The formula is IV volume remaining by the drops per minute that will be given to you and the drop factor. You want drops, so you must have a drop factor, right? Always remember, they will ask you drops per minute, you will have a drop factor. So IV remaining is 200 ml, drops per minute is 20 they want, and they have the drop factor. The set that they're using is 10 drop with a drop factor of 10. So after calculation, it is 100 minutes or 1.6 hours. You turn minutes into divided by 60, that is 1.6 hours, or you round it to 2 hours. Nearest whole number. Next, we are talking about pediatric drug calculation. It is very different from the adult what we saw so far. And basically, it is divided into 3 types. One is the Young's formula, the Dilling's formula, Freit's formula. Freit's formula, generally, we do it for pediatrics who are like in months, not in years, less than 1 year. And Young's formula is the one that we are using for children who are less than 12 years but more than 1 year. Okay. Now, what we generally use for what we generally use is what we are most common or simplified way is the Young's formula. We always use very familiar with the Young's formula. That is, dose of a child will be the age in years. For example, 2 years divided by age plus 12. That is 2 plus 12 into adult dose that is available with you. Okay. Dilling's formula is the same, just that you will divide it by 20. Freit's formula will be age in months divided by 150 into adult dose. Now there is another formula that we all know, that is Clark's formula, that is for the body surface area. Now you don't know how much mg or whatever. So how you will decide the dose? So if it is in pounds, it will be your lb divided by 150 lb into your adult dose. Now if your weight is in kgs, it will be weight in kgs divided by 70 kg. What you have to remember is this standardization of 150 and 70 into adult dose. Okay. This formula, why I have introduced is that this is a standardized formula called Holiday-Segar's formula or the 421 formula for fluid resuscitation or for fluid therapy. Now, for each kilogram, we have 3, you always remember, we have 3 divisions. For each kilogram from 0 to 10 kg, we will add 100 ml, and to that we will add the hourly requirement, that is 4 ml. So it will be, for example, 400 ml, 4 ml per kg per hour. That will be 4 ml into, for example, you want to give within this 0 to 10 kg. So into 10 per hour will give you 40 ml per hour. Now, for the next is you will give 2 ml per kg. So 2 into 20, that will give you 40 ml per hour again. So for children or for patients who have less than 20 kg body weight, it will be body weight plus 40. For example, 70 kg patient will be 70 plus 40, so 110. So this formula is generally the absorbed formula, that is a 4-to-1 formula we call it, for patients whom we want to start with a fluid therapy. And if any physician tells you that we want to start we start a fluid based on the Segar's formula, generally they will not say Holiday Segar, they will say Segar. Segar is a general thing, or they will say 4-to-1 formula. So don't panic. This is a 4-to-1 formula. For every 10 kg, we are adding 4 ml. For 11 to 20 kg, we are adding 2 ml per kg. Okay, and for more than 20 we are adding 1 ml per kg. So this is your daily requirement, and this is your dose that you need to remember. Great. This is your short exercise, very simple. You have heparin 6500 ordered, your available dose is 15,000. How much ml should you give? Put your answers in the comment box. Your erythromycin is 250 mg, but this time I have it diluted in 100 ml of dextrose water. Now, it should be given over 30 minutes. So give me my ml per hour. Put your answers in the comment box, and let's see how well we have understood the concept. Do stay tuned, because I will give you the dopamine infusion. How do you start a dopamine infusion if the doctor tells you start it at 5 max per minute? So how will you do it? So stay tuned with the next video.